Care and handling of specimens. Please take a moment to review the learning objectives prior to completing this presentation. Proper handling and transport of specimens after phlebotomy is critical to maintaining specimen integrity and providing accurate patient results. When transporting specimens on site, it is preferable to keep the specimens upright. The maximum recommended time from draw to processing is 2 hours, and many couriers or those who collect blood at outlying areas may actually have a centrifuge in the car which plugs into the lighter. Many larger facilities will use a pneumatic tube system to deliver blood from patient care areas to the laboratory. These are very similar to the ones used by the bank at the drive-thru. It is important when sending specimens through the tube system to seal them in a fluid-resistant package before sending them through to minimize contamination to the interior of the tube system. After specimens have been drawn and properly labeled, they should be prepared for transport. Remove all blood from the exterior of the tubes. Often a small drop will remain on the outside of the tube where it attached to the hub. Place them into the interior of the bag and seal the package thoroughly. Check to make sure that it is sealed. The bag has an inner and an outer compartment. The inner compartment will contain any spills during transport. Paperwork should be put into the exterior, so in case of a spill, the paperwork is not contaminated. The whole bag is then sent through the pneumatic system. When sending specimens to an outside laboratory, it is important to package the specimens according to their instructions. All specimens must be properly labeled as biohazard. The DOT, FAA, and numerous other government agencies have very specific instructions for how to label and ship infectious materials. It is important to be properly trained on this, and in-service may be required for certain personnel, such as couriers and those who routinely carry blood from one place to another. Failure to properly label specimen containers shipping through public areas such as the mail or on airlines may result in fines of tens to hundreds of thousands of dollars. Many tests have special transport requirements, and you should be aware of these prior to drawing them. Temperature is critical for certain testing. Many need to be kept cold from time of draw to time of processing. The best way to do this is to place it into a plastic bag, such as used to ship for the pneumatic tube system, or simply to put it into a glove and then place it into an ice bath. It is preferable to use ice and water, as this gives a more stable temperature than ice alone. There are specially designed cold transport containers available. After drawing the specimen, put ice into a plastic container, and if you throw one on the floor, you pick that up later. You're going to cover the ice with a little bit of water, generally out of the faucet. But for demonstration purposes, this will work. Take the tube, stick it down into one of the fingers of the glove. Then, just like tying off a balloon, you're going to twist the rubber of the glove and tie a knot in it. This can be cut when it gets down to the processing area. Set the tube down into the ice bath and return it to the laboratory as soon as possible. Likewise, certain specimens must be kept warm during transport. Again, these will be placed into a plastic bag or a glove to keep them from getting wet and obscuring the patient information. They can then be placed into a thermos of pre-warmed water, preferably kept at body temperature. There are specially designed containers that can also be used. Occasionally you'll get to the floor and will not have what you need for transporting specimens that are to be kept warm. Not preferable, but sometimes what will work is to wrap it into an infant heel warmer although the infant heel warmer gets a little higher than body temperature and may cause hemolysis, resulting in a redraw. The other method is the armpit method. This is not approved or endorsed by any official agency that I know of, but it does work. Place the specimen in a glove and clamp it tightly under your arm as you return immediately to the laboratory. Specimens that require protection from light should be handled very carefully. The tube should be wrapped in aluminum foil or brown paper towels. The specimen must be completely covered. Some tests, including the B vitamins, will be affected by as little as 5 minutes of exposure to light. In most cases, a glove is not enough protection from light. If you can hold the glove to your eyes and you see light coming through it, this will not protect the specimen. After labeling the specimen, wrap it in aluminum foil, and we have about 3 times more foil here than what we actually need, but the specimen needs to be completely covered. Make sure you seal both ends. If you're sending it through the tube system, you put it in a bag. Otherwise, you simply deliver it to the laboratory. Once the specimens have been received in the laboratory, they should be logged in, either on a paper log or more commonly in the computer. Tubes should be centrifuged to remove the serum or the plasma as needed. Specimens may be aliquoted for send-out testing, or they may be aliquoted for use in multiple departments. Finished specimens should then be stored for future access. Routinely, specimens are kept anywhere from 3 to 7 days. When tubes are brought down, you should check the specimen labeling. Make sure that all of the patient information is on there and correct. Any tubes which are anticoagulated should be inverted and checked for a clot. Again, every single specimen should have the ID checked. Make sure that specimens have been filled to the proper volume. SST tubes should be clotted. Again, check the specimen ID on every specimen, the specimen fill volume, and then make sure that there are no clots if there aren't supposed to be. When aliquoting a specimen, check your specimen labels against the original patient label. Make sure all information is identical before proceeding. Place labels on the proper containers. Specimens that require protection from light will be aliquoted into a brown container to keep them protected throughout the transport process. Make sure that you put your initials on all specimen labels to indicate that you are the one who aliquoted the specimen. Take a transfer pipette and carefully remove the plasma or the serum and place the appropriate amount into each aliquot container. Put the lid on the original container and then thoroughly seal all containers. Screw on the cap as needed. And it never hurts to check the ID one more time. Specimens that do not have a lid should be sealed with parafilm. And then be sent to the proper place. Rejecting specimens. The most common cause of rejected specimens is mislabeling. You should always label the patient's specimen before leaving the patient's bedside. You should follow standard labeling procedures exactly. No matter what else you do, if you misidentify a patient, that can't be fixed. Other reasons for rejecting specimens: if it is drawn in the incorrect tube. Make sure before you go to draw the specimen that you know what you're supposed to be drawing. Don't guess. Call to the laboratory if needed and clarify orders prior to drawing the patient. Commonly we'll have people get to the floor, not know what to draw, so they'll just draw an SST tube. Well, unfortunately, if I need 2 heparin tubes pre-chilled and drawn on ice, 1 SST tube at room temperature isn't going to do anyone any good. You should always have a variety of tubes available on your tray. Specimens which should be kept cold, kept warm, or protected from light, as previously discussed, if not properly handled, will be rejected, and you will have to return to the patient and draw them again. As with tube requirements, always be aware of special handling needs before drawing a patient. Improperly filled tubes will also be rejected. When you learned the color and content of the tube, you learned the proper fill volume for each. You need some serum, or enough to do the test. Anticoagulated specimens, in general, should be filled to half of the draw volume of the tube. Again, remember, that's not necessarily half the tube, but half the draw volume. Sodium citrate tubes, or the light blue, need to be 90% full for processing and testing. As you remove specimens from the hub, you should turn them upright to make sure they are properly filled before removing the needle from the patient's arm. Specimens received in an expired tube will not be used in a real lab. Obviously, in our lab, everything's expired. Many specimens must be collected at a specific time, relative to medication, treatment, or other timed draws. Hemolysis is also a cause for rejection. The red blood cells lyse and release the hemoglobin into the serum or the plasma. This specimen shows no hemolysis. Normal plasma is anywhere from colorless to yellow. This shows a trace hemolysis, or 1+. This is slight, or 2+ hemolysis. This is moderate, or 3+ hemolysis. And this is 4+, or gross hemolysis. If it weren't for the SST layer, you wouldn't be able to tell where the serum ended and the cells began. Common causes of hemolysis include rough handling, such as shaking or vigorous mixing instead of gentle inversion of the tubes, or allowing the specimens to get too hot or too cold. This is especially important when transporting specimens in a car. Leaving specimens in a car during winter or during the height of summer will cause them to be hemolyzed unless they are in a temperature-controlled cooler. Using too small of a needle will cause hemolysis. Remember, no needle under 23 gauge should be used for blood draw. Too much pressure on the blood as it's being drawn. Using a small butterfly with evacuated tubes can sometimes cause hemolysis, or especially when nurses are drawing from an IV start and pull back too hard on the syringe. Remember, only pull back on the plunger of the syringe as rapidly as the blood will come in. When collecting a dermal puncture, hemolysis results from squeezing the site instead of milking it properly. Another reason for specimen rejection is clotted anticoagulant specimens. The most common cause of this is improper mixing. It's more likely to happen with a syringe draw due to the increased time before the blood is mixed in with the anticoagulant. Overfilling tubes, most commonly found when filling a tube from a syringe, can overwhelm the anticoagulant and allow the specimen to clot. Anytime there is difficulty with the venipuncture and you have a particularly slow draw, The blood clotting may activate prior to mixing with the anticoagulant in the tube. Lipemic specimens contain triglycerides, or fat, in the serum or plasma. This is a patient-related issue and nothing to do with phlebotomy. The specimens with only slight lipemia may improve if the patient has been fasting. Here we see a trace of lipemia, and there is actually a trace hemolysis with that as well. This is a slight lipemia. The plasma or serum should be clear. This is moderate or 2+ lipemia. This is marked or 3+ lipemia, and this is what we refer to as gross lipemia. Often we will see lipemic specimens that are also hemolyzed or icteric. Icteric specimens are caused by an increase of bilirubin in the blood. These are a result of liver problems, such as hepatitis or cirrhosis. These specimens range from bright yellow or orange all the way through to a greenish yellow or brown color. They may appear almost fluorescent,